Doctor, our next question.
Hi ma'am, my name is Bensi Joseph and I have a question please. I have heard that the cancer can be cured when it is detected at early stage. What are the available options for the detection of gynecological cancer?
So as you have rightly asked, prevention is probably the best way to fight cancers. So as far as gynecological cancers is concerned, the only cancer which can be very effectively prevented is the cancer of the neck of the womb or the cervical cancer. What we recommend is a pap smear, which I have already told. Like you take a small smear, that is, you rotate a small spoon-like wooden spoon-like thing just beside your cervix, and whatever you get, you put it on a slide and send it to the doctor, the pathologist, for to have a look under the microscope. From this only you can detect what we call as precancers. So precancers are something which over a period of time can progress to cancer. So once you detect precancers, you can we can treat by just removing that small portion of the cervix by an operation which doesn't even require an anesthesia. So the recommendation, as I have told, is start doing it once you become sexually active, say after 21 years, do it every 3 years till you are 30, and thereafter every 5 years till the age of 65. Then coming to other cancers, next is ovarian cancer or the cancer of the ovary. We do not really have a good test so far to detect it early. So you be aware of yourself, you know about your body, and if any new symptoms like any pain or aches in your abdomen or the tummy, or if any change in your bowel or bladder habits, as I have told earlier, you report to your doctor and get a gynecological evaluation as well, because it's very non-specific. Then there are some studies going on in Western countries, like doing a scan, an ultrasound scan, or every year, and doing a blood test known as CA-185, and whether it can help us to detect ovarian cancer. But they are quite expensive, and it's not practical to do it on a large scale. And coming to uterine cancers, most of the time uterine cancers present at very early stage with abnormal uterine bleeding. So many times we don't have a problem, like they don't present in advanced stages, and even if at all uterine cancer, most of the time you can treat it very effectively, and it is almost 100% curable. Then vulval cancer, again the cancer of your external genitalia, there are no effective screening tests. Again, since it is outside, any changes, any small ulcers which doesn't heal, or any persistent itching, anything, you have to report to your doctor to detect it early. So again, to sum up, the only effective cancer which can be prevented is cervical cancer, is by doing a pap smear on a regular basis.
Doctor, we have got a mail.
Okay.
It's from Kasaragod. One of my aunties have a huge lump in the uterus. The doctor said it's as big as a 5-month pregnancy and advised for an open surgery. Is it okay to have a keyhole surgery?
Yes, it's quite possible. Like a lump in the uterus, the commonest one is fibroid uterus, as many of you might have heard about. So 5 months of pregnancy is it's almost just below your belly button or your umbilicus. So it can very well be tackled by laparoscopic surgery. The only thing is that you may have to remove it laparoscopically using a special instrument known as mosulator, or partially it can be removed from down below, that is vaginally. The only situation where you need to think of an open surgery is when we suspect cancer. So since if the scan finding or if there is no clinical suspicion of a cancer, you can go for keyhole surgery. It's quite safe, and generally size is not a big problem with laparoscopy. As long as you can visualize it well with your camera, you can do a better job with laparoscopic surgery than open surgery, because of the better visualization and the magnification you have. I think I made it clear.
And how do they do this laparoscopy surgery? You said a 5-month, as big as
5 months, as I've told, it's below usually laparoscopes are put in the belly button or the umbilicus, but for bigger tumors we go much above that, and we can put in the scope, and basically the laparoscope is basically a camera. So to see it is a big tumor, you have to go a little farther. That is the basic thing. So as long as you can have a good visualization, you can tackle any size laparoscopically. The only problem is, again I stress, the good visualization, and anything else can be handled.
No, doctor, how do you remove this big
Yeah, that's why I was trying to tell you, like there are two ways of removing it. Either you have an opening, natural opening below, that is a vagina. Once you are removing the uterus, you can remove it vaginally. And sometimes you may have to reduce the size using a special laparoscopic equipment known as morcellator. So that with that you can reduce the size of the tumor, and remaining you can remove from vagina by cutting it.
So that means, doctor, she can go for a keyhole surgery.
Yes, obviously, because see, if you do a laparoscopic surgery, usually what we do is we discharge the patient the very next day. So that's quite, the recovery is quite fast. So for a big tumor, in fact the advantages are more in a bigger tumor, because you need a bigger cut to remove a bigger tumor if you do open surgery. But with laparoscopy, she will have a very small cut like any other laparoscopic surgery for this big tumor, and she will be happy at the end of the day.
How many days rest she has to take?
After open surgery we tell say 2 to 3 months rest, but laparoscopic surgery I usually tell my patients to restrict their activities for the first 1 week, and do not do any hard work for another 1 month, because they only need to have a good healing of all the pedicles or the vessels leading to all the organ which we have removed. Otherwise it doesn't take much time for the wound on the abdominal wall to heal.
Doctor, it was really informative. Thank you so much for spending your valuable time with us.
Thank you so much.
So friends, write your suggestion to us. Our email ID is youthdiaryrosebowl@gmail.com. See you next week.